Okay, well, we'll just get started. It is 10 o'clock. So once again, good morning to everybody. I'd like to welcome you to our webinar today. And we're going to speak to some new and exciting things that are happening at ARTA. I'll introduce our presenters today. My name is Jennifer Hope. I am the Affiliate Marketing Advisor at ARTA. We also have Gary Sawatsky here, who is our Chief Operating Officer, and as well as Amanda Shaw, who is our Chief Marketing Officer. So in addition to the plans that we currently offer now, HealthWise, HealthWise Plus, Total Health, as well as Ultimate Health, we are going to be introducing 6 more benefits plans that are geared towards some of our members who are under the age of 65. And Gary is going to speak to those plans in detail in our presentation. We do have some housekeeping things that we need to talk about. Just so you know, this presentation will be recorded. We will be uploading this onto our YouTube channel, so you can always go back and, you know, if you feel like you missed some information, you can go to our YouTube channel and revisit the presentation. Because the presentation is being recorded, we have disabled your video as well as your microphones to protect your privacy. And if you have any questions throughout this presentation, please use the Q&A function in Zoom. And the Q&A function is just that little chat bubble in your Zoom menu. So just click on the little speech bubble there and type in any questions that you have throughout the presentation, and one of us will get to your question as we go on. So first off, I'm going to speak to some ARTA member advantages that you receive being an ARTA member. I'm sure a lot of you are already aware of some of the fantastic advantages you do get while being a ARTA member, but I just thought I would highlight some of the main advantages that you get in addition to your retiree benefits plan. So we have our Boom discount program, which I hope some of you are familiar with, and you receive some really great discounts on hotels, car rentals, various retail outlets. So you can go online and go sign into your Boom account and see all the discounts that you can really get. It really stretches your retirement dollars further, and you can get, you know, some different discounts at Calgary Zoo, different retail outlets, so you can save a lot of money by using your Boom discount card. We also have a really great partner in TW Insurance, and you can get some discounts on your home and auto insurance. They also have a life insurance program that is geared towards our membership. So if you visit arta.net and search for TW, you can visit their page and their contact information is there, and you can get a quote and perhaps receive some really great discounts on your home and auto insurance. Wellness is one of ARTA's strategic goals, and we try to promote wellness in retirement in a variety of ways. We have a physical wellness challenge that you can take part in every year, where you can submit your time spent on a physical activity and you can win some really great prizes. We have a photo contest where you can submit your photos into ARTA, and your work can be published in our News and Views magazine, and again, receive some really great prizes. We have a writing contest. I don't know if there's any English teachers out there that, you know, enjoy writing still. You can submit your work. We have fiction, nonfiction, as well as a poetry category, and we add some different categories every year, and you can submit your work and win some great prizes and have it published in our magazine. We also have a mental wellness challenge that is kind of new to ARTA, and members have really enjoyed doing that and winning some great prizes and learning some new ways how to stay mentally well, especially in, you know, in today's environment. We also have a really great scholarship program that we offer to our members, family members. So any direct relatives that you have pursuing post-secondary, they have the opportunity to receive a scholarship from ARTA. We award over $40,000 a year to our recipients. We have diploma programs as well as other programs that they're able to submit their scholarship information to. We have an ARTA apparel store where you can purchase some really great branded clothing at discounted prices. So if you visit artaapparelstore.net, take a look at what's on there and you can get some really great clothing at discounted prices. We also like to regularly communicate to our members. I'm sure a lot of you guys have seen our News and Views magazine in your mailboxes, which we send out every season. We're always trying to improve our magazine, and the articles in there are really relevant to our membership. We're really proud of it. So always watch for that in your mailbox. We also have our Artifacts email newsletter that we send to our members, which provides any updates on ARTA. I'm sure this is how maybe you found the webinar and signed up for it through the newsletter. We're also current on our website. Stay tuned for some really exciting changes that are happening on our website. And as well as our social media channels, Facebook, Instagram, YouTube, and LinkedIn. We're very active on those mediums, and you can find all of the information that you need. I'm going to hand it over to Gary Sawatsky, our Chief Operating Officer, and he's going to kind of speak about some new exciting plans that are coming into ARTA.
Thanks so much, Jen. We have 4 new plans starting November 1st, and Jen mentioned that we have 6 new plans that we're currently working on. The other 2 new plans, which we're not talking about during this presentation, but we actually have another webinar starting at 11 o'clock, is about those other plans, and that's the ARTA RX plans. So for today's benefit plan introductions, we have 4 new plans. First is the introductory plan. This plan was designed for people who do not have group benefits coverage. They're not coming off of an active employee group plan or any other plan, but they want access to benefits because they didn't sign up for them when they first retired, but now have realized they would really like to have some coverage. Next are the comprehensive plans. These are designed for people who are not yet age 65, but are coming off of a group benefits plan. It's designed for people who don't yet have the Alberta Healthcare Plan for seniors coverage. So as you'll see when we go through the comprehensive plans, the maximums are a little bit higher for things like prescription drugs because they don't have the Alberta Healthcare Plan for seniors as first payer for the comprehensive plans. It was really designed for people who are, they're not yet age 65. They may have retired early. They may have retired at age 55, age 60, and perhaps the build your own plans that we provide, which were designed for people age 65 and over with relatively low prescription drug maximums. That coverage can be gained by taking one of the comprehensive plans. And finally, as I mentioned, the build your own plans. These are the plans that ARTA has always had. A lot of you are probably covered under one of these plans already. We are changing the name. We're calling them the build your own plans. They are designed for those people age 65 and over. Just so that I know one of the questions that's going to come up is, do we have to take one of the comprehensive plans if we're under age 65? If we're already in one of the build your own plans? And the answer to that is no. You can take it if you're under age 65. You can move from a build your own plan to one of the comprehensive plans, but you don't have to. If the build your own plan is sufficient for your needs, then by all means, stay in that benefits plan. You don't need to move. So the primary health care plan, as I mentioned, this was designed for people who may have retired prior to age 65, who did not take benefits when they retired. They are potentially worried about filling out a medical questionnaire. They're not sure if they would be granted coverage if they filled out a medical questionnaire. Or perhaps they retired at age 55 and they wanted to transition into a new career, which does not include group benefits. So they may have started their own company. They didn't get group benefits at that time. Now some time has passed. If it's more than 60 days since losing group benefits coverage and you are worried about filling out that medical questionnaire, this is the plan for you. The best feature about this plan is once you've participated in it for at least 3 years, you can then transition into one of the comprehensive or build your own plans. So it's a great way for you to get into one of our more comprehensive plans if you didn't take benefits when you first retired. Next slide, please, Jen. So this is the basic coverage under the primary healthcare plan. We cover all expenses at 80%. The overall maximum per year is $7,500. We have a tiered coverage for prescription drugs. So the first year that you're covered by this plan, you only get $600 of prescription drugs. In the second year, $900, and in the third year, $1,200. The reason we do that is to protect the plan from adverse risk. We don't want people coming in who know they're going to be claiming a lot out of the chute. And so we tier the prescription drugs for that purpose. We have vision care coverage of $200 every 24 months. The combined annual maximum for paramedical practitioners is $750 per year. We cover hospital room, semi-private rooms up to 30 days per year. Accidental dental is $2,000 per incident. And this plan also includes some emergency travel insurance. It's not as good as the rest of the travel insurance that ARTA provides. This plan covers you up to 15 days per trip with an unlimited number of trips. But this plan also includes a stability clause, which is not included in any of the other travel plans which ARTA provides. Next slide, please, Jen. The comprehensive plans are designed for those people who are coming off of a group benefit plan. And we've designed these to provide a level of coverage which best suits your and your family's needs. So as you'll see when we start to go through the plan comparison, we have some relatively entry-level plans, and we have some, I would call them the Cadillac plans. They cover a wide range of benefits that may not currently be provided to you through our build your own plans. This is a quick comparison of the comprehensive plans. We have 3, we call them core, essential, and enhanced. These also cover 80% of eligible expenses, up to $10,000 per year for the core and essential, and up to $15,000 per year for enhanced. The prescription drug maximum you'll see is higher than what you would normally get through the build your own plans, starting from $1,500 up to $5,000 per year with the enhanced health. For a lot of people, that's going to be more than sufficient. But if you do have some very expensive medications, for example, if you're under age 65 and you are taking a biologic or specialty medication, these might not be the right plans for you. For the other 98% of people who are not taking a specialty medication, the $2,500, the $5,000 is more than sufficient for you. We cover vision care from $200 up to $500 every 24 months. Hearing aids from $700 to $1,100 every 3 years. The combined annual maximum for paramedical practitioners starts at $750 per year with core health and goes up to $1,500 per year for enhanced health. We cover medical aids, canes, crutches, hospital beds, all this, the exact same list that we cover with the build your own plans, the current plans, is included under these plans as well. Private duty nursing from $1,500 per year up to $2,500 per year. Accidental dental of $2,500 per incident. We cover diabetic supplies under this benefit, as well as CPAP or breathing monitors, starting at $500 every 5 years up to $750 every 5 years. Next slide, please, Jen. To continue the comparison, we cover wheelchairs and scooters up to $1,500. Ambulance, ground and air ambulance, hospital room, private or semi-private room, orthopedic shoes, $500 every 3 years, foot orthotics. We have a member assistance plan, the same plan that we're rolling out for the build your own plans. Starting November 1st, you get access to with the comprehensive plans as well. And this plan also includes ARTA's excellent emergency travel plan that covers you up to 92 days per trip with no stability clause for pre-existing conditions. So it's the exact same plan that you have now if you're covered under one of the build your own plans. And that plan is available to be extended up to 212 days for any single trips with the exact same coverage you would get under the base plan. These plans also include embedded dental care. So one of the biggest differences between the build your own plans and the comprehensive plans is these plans automatically include dental. So the primary health has 70% coverage up to $750 per year with no coverage for major or ortho. The core health improves on the primary. It covers you at 80% up to $1,000 combined per year. The essential health bumps up that annual maximum to $1,750 per year. And the enhanced health, again, this is the Cadillac plan, also covers major restorative, so things like dentures, implants, crowns, etc. Plus, it covers orthodontics. Sometimes when we are retiring, we could be age 55, we could still have teenage kids at home who need orthodontics. And so that's built into the enhanced health as well. And in addition, for the basic and major, you get up to $2,000 per year combined. I'll turn it back over to Jen to talk about the plan summary and the rate sheet.
Thank you, Gary. If you want to go look at our new plan summary, our plan summary outlines all of our new plans and goes into detail exactly what you would be covered for. You can find that at arta.net/2021 plan summary. As well, on this page, you'll be able to find all of the rate sheets associated with the plans. So you can find the education sector plan, the public-private sector rate sheet, as well as our participating organizations rate sheets. So whichever group you belong to, you'd be able to find the rate sheets on this website. And the rate sheets outline all of the plans and the associated monthly premiums. So visit this page, check out the plan summary, check out the rates, and it also has an application form on there. If you want to switch from the plan that you're on now to a new plan, if you decide to do so, all of the forms are available on this website. Also, if you have any questions after this presentation and your question wasn't answered within the presentation, please email marketing@arta.net and we will be happy to answer any questions that you may have. And again, this presentation will be uploaded to our YouTube channel if you want to go and revisit some of the information that was provided to you today. So if there are any questions currently, you can pop them into the Q&A box and we'll be happy to answer them. If not, that's all we had for today, and have a wonderful week. I don't see any questions coming in. So again, if you have any questions afterwards, oh, here is a question. Was the plan just spoke of for those age 65 plus? The new plans are actually geared towards our members who are under the age of 65 years old. If our build your own plans that we currently have, the health-wise plus total health as well as ultimate health, those plans are geared towards our members who are over the age of 65, as they are built to complement the Alberta Seniors Drug Plan.
Yep. These plans actually terminate at age 65. So at that point, you can then transition into one of the build your own plans. There's a question regarding how do our plans compare with those who stayed with ASCVP? I think they compare quite favorably. Unless you're one of those 2% of people who are needing a specialty or biologic medication, I think these plans would compare very favorably, both in terms of plan design as well as monthly rate. I think if you were to compare line by line, you'll see that the plans themselves are fairly close, if you were to compare the monthly rates, you will see that ours are quite a bit more competitive. We have a question. Would ARTA consider separating out psychological services from the other paramedical services? That's actually one of the reasons we're bringing in the member assistance program. We realize that there are certain needs that we want to be able to respond to our members, especially in terms of psychological help. And so starting November 1st, we have a member assistance program designed specifically for our members. So we're not changing anything with the paramedical practitioners. If you want to use the annual maximum for psychological services under the current extended healthcare plan, you may, but you may also want to check out the new member assistance plan.
There are quite a few questions that are asking about how the new plans work when partners have different ages. The plans that are available to you are always based off of the primary plan member's age. So if the primary plan member is under 65, both plan members can move over to that plan.
We have a question regarding the built-in dental benefits in these plans being the same as the other ones. They are essentially the same. The coverage levels are a little bit different, but everything that's covered under the build your own plans will continue to be covered under the new comprehensive plans. We also have a question about ARTA RX. We actually have a webinar starting at 11 o'clock that will dive into everything regarding ARTA RX, both the plan and the pharmacy.
The presentation will also be recorded and put on our YouTube channel, and the ARTA RX plans are available to Alberta residents only.
We have a question regarding whether the MAP would require a person to start with a new psychologist, or would it cover the current psychologist? There's a really good chance that the psychologist is in the MAP network. It's a very wide and diversified list of psychologists provided through the MAP. So I would encourage you to check out the MAP first. The psychologist you are working with currently could very well be eligible through the MAP as well. And if they are, you can select to continue with that psychologist.
There's a question asking if we plan on removing the existing plans. Absolutely not. The HealthWise Plus, Total Health, and Ultimate Health plans will always be available to current members and future members. We're just introducing additional plans to ensure that every ARTA member has the option to have the coverage that's best fit for themselves and their lifestyle.
We have a question regarding what is ARTA RX? ARTA RX is a few things. Number one, it is a pharmacy that we are opening. It is wholly owned by ARTA and is designed to essentially provide prescription drugs for our members and deliver them to their door. It's primarily designed around maintenance medications, so we'll be able to tell exactly when your prescriptions are due. We can have your drugs delivered to your doorstep, and it's a much more efficient way of providing benefits to our members. It's also working with a focus on the pharmacists dealing directly with the members. It's not a big box store type pharmacy, which is simply trying to fill as many prescriptions as possible. It's looking after our members' health holistically. So making sure that they are taking the right drug at the right time. And if they are able to take them off of some drugs, all the better, by doing that comprehensive review to make sure that the drugs that you are taking actually make sense. The second thing it is a new plan. So for people who are using ARTA RX, who have agreed to move their maintenance medications over to ARTA RX, the pharmacy, we have a special ARTA RX plan, which provides very good benefits which are actually better than our ultimate healthcare plans, with premiums that are just a little bit more than our total health plans. So you get better benefits for less money. It's a win-win. As I mentioned, we have a webinar talking about ARTA RX coming up at 11 o'clock.
There are a couple of questions in the chat in regards to us sending out a comprehensive booklet that outline all of the options. We aren't going to be mailing that out to every single member, just because a lot of members won't be interested in switching, and so it's not the most cost-effective way. If you would like a comprehensive booklet that outlines all of the options and decisions, you can email this email address on the screen. They're actually just being printed this week and will be ready for us to mail out within the next couple of weeks, and we can absolutely send you one. There are no deadlines to switch. Gary, do you want to talk a little bit more about deadlines to switch and how that works?
Yeah, you bet. You can change it anytime. By all means, if you can send us a change form, we can process it and we can move you into your new plan. You don't need to change this week, next week. If you want to do it 6 months from now, you are certainly able to do so at that time.
And Gary, can you talk to individuals who are over the age of 65 and did not take a medical plan in the first place, and what their options are now and how that kind of works? That's in the chat too. So
oh, okay, let me find it in the chat. Over age 65 did not take a medical plan in the first place. Yes, you absolutely can. If you are over age 65 and you are an ARTA member, you can take either our HealthWise or HealthWise Plus plans without medical evidence of insurability. Keep in mind, those plans do not include any emergency travel coverage. So if you want one of the plans with travel, you would need to submit medical evidence of insurability.
Cool. I think that is it for today. And if you have any questions afterwards, please feel free to email marketing@arta.net. Have a wonderful afternoon, everybody.